Okay, so in this video we're going to test the movement of the extrinsic muscles of the eye, which are these ones that you see here in this model. So we have a superior oblique muscle that is located in this area, that it is not shown because we have here the lacrimal gland, and then we have this one that is called the superior rectus. This is the inferior rectus, medial rectus, and lateral rectus and inferior oblique in here. Now, these muscles help us to move our eyeballs in different directions, and they are innervated by different cranial nerves. So, for instance, the superior oblique, it is innervated by cranial nerve number 4, which is called the trochlear nerve. And then the lateral rectus, which is this, is innervated by cranial nerve number 6, which is called abducens. And then the rest of the extrinsic muscles of the eye are innervated by cranial nerve number 3, which is oculomotor. So indirectly, as you're testing these extrinsic oblique muscles, the movement, you are also testing for the function of these cranial nerves. So this is what then you will be doing for testing for the superior rectus and inferior rectus. So you will have either in yourself your finger or an object that you will have to follow with your eyes, but that object is supposed to be at least at a minimum distance of 12 inches away from your eyes, okay? And then in order to test for the superior oblique, superior rectus, you have to move your finger up and then follow with your eyes. Now you will do that slowly, bring it into the center, and then do it again twice. And then for the inferior rectus, you will do the same, but going down, so you have your finger centrally in front of the eyes, and then you bring it slowly down, bring it up again to the middle, and then going down again, and then again to the middle. So that's for superior rectus and inferior rectus. Now for lateral rectus, so you will have the the finger and the eye following the finger to the sides like this, and to the center, and then to the side, and then you do it on the other side as well. So at some point when you're doing this movement for the lateral rectus, you are also testing for the medial rectus on the contralateral side, because when you're moving with your right eye, your eyes toward the right, your left eye is following medially, and then you are contracting your medial rectus, and will be vice versa. Now for the superior oblique and inferior oblique, so the superior oblique, it is moving our eye down and laterally, like if you were cheating. So that's your cheater muscle, okay? So you will ask the person to follow the finger down and laterally on both sides. And then for your inferior rectus, it is like if you were intellectual thinking, so you will ask the person to follow, or you will do it in yourself, to follow the finger up and out, or up and laterally, like this, and on both sides. Now if you want to do all the movements at once, okay, you can do like a figure 8, and then the person will follow it. And just lastly, to test for your medial rectus, the one that converges the eyes medially. So you will have the finger 12 inches away, and then move it closer to the face, and as a person, or you do it yourself, to follow the finger, and then suddenly you become cross-eyed. Okay, do it slowly and do it again. Okay, and that's how you test for the extrinsic eye muscles.